Yes, thank you very much. My name is Emmanuel Ainebion. I work as a Senior Public Relations Officer at the Ministry of Health. I wish to note that Uganda appreciates and continues to be a beneficiary of support from the United States of America. And I wish to note that following the assumption of office of President Donald Trump, he signed an executive order that freezed all financial aid to foreign countries as part of his new foreign affairs policy of the United States, and that meant suspension of aid to countries like Uganda for a period of 90 days to allow review of the various agreements under which that aid was being extended. So Uganda has been receiving support mainly through the Centers of Disease Control and Prevention, which is CDC, United States Aid for International Development, that is USAID, and also PEPFAR, where there is support towards HIV AIDS prevention programs. So that meant that with this suspension, some staff in country had to have their contracts terminated for that period until further communication. So some of these staff were working within our health facilities. For instance, there are those ones who were manning the AIDS treatment, antiretroviral treatment clinics within our facilities that were being paid under the USAID funding. So that meant these people are now not at our facilities. That includes any other support that has been coming in terms of, for instance, support to the behavior change campaigns. I hope you are aware of programs like Oblamu that would run messages on TV. But I wish to emphasize that later on there was clarity that some programs like HIV treatment were given a waiver. So that support continues to come, and also now we have the outbreak of Ebola, which still the US government is extending financial support towards the response. So it's not withdrawal as framed within your questions. It was just a suspension, but this has not totally led to the withdrawal of that aid. But you can contact the US Embassy for an interview like this to get their side of the story. But as Uganda, we appreciate the support from the American people, and we continue to have them as our key partners within the health sector. I wish to emphasize that as Uganda, we have, of course, realigned our programming and integrated HIV/AIDS treatment with other services. So now we are taking on an integrated approach. Our health workers who are paid by government of Uganda are now responsible, for instance, for attending to those who are seeking HIV/AIDS treatment and care. They are able to get drugs now alongside other patients, for instance, for diabetes, for hypertension, at an integrated clinic, not separate clinics for activities that we are funded as we continue to talks with the US government, and also as wait for the 90 days of suspension to elapse. Thank you very much. I hope I've been able to answer your questions.